Okay.
Okay.
So seizure is a transient occurrence of signs and symptoms due to abnormal, excessive, hypersynchronous neuronal activity in the brain. Okay. It is abnormal. Obviously, it is not abnormal. It is excessive and it is hypersynchronous neuronal activity in the brain. Okay, so 5 to 10% will have at least one seizure. This number is very important. Repeatedly keep on there asking. The thing is, you people will get confused when they give options. So 5 to 10, 15 to 20, 20 to 0 to 5, 5 to 10, like that they will give. So when they give like that, uh, you will get confused and you will not be able to answer. Okay, so o- this is the seizure. Okay, what do you mean by epilepsy? So epilepsy is if there is any recurrence of seizures because of unknown cause or known cause, whatever it is, and that cause is not treatable, then only it is called as epilepsy. It is just one episode of seizure, unless and until there is some tumor or it is an epileptic syndrome, it is not called as epilepsy. It is just called as acute symptomatic seizures. That's all.
So
Okay.
does it depend on EEG findings? So
No, 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 no. See, EG, you don't worry because if presumably now 32 students are here, including me 33, 34. So if we do for all of us, there will be some spike and wave discharges. It will be there. Okay. See, it is a neurons. How many neurons are there? It is a MCQ question. I will not ask questions. I will only tell the answer. It is 10 to the power of 11 neurons. Okay, that means 100 billion. This will be asked. People, you can note down. 10 to the power of 11 neurons are there. Okay, so that is 100 billion neurons are there. So definitely some there will be abnormal activity. Sometime there will be excessive activity for all of us, but most of the time it will not be synchronous neuronal activity. That is the reason why most of the normal people will not have seizures. When all the three goes together, then only there will be seizures. So EG and related to that is a clinical only. Okay, so EG will not come into picture here. So this seizure incidence will be 5 to 10%, at least one seizure. Incidence of epilepsy is zero point 0.3 to 0.5%, repeatedly asked. What they will ask is zero point 0.1 to zero point 0.3, zero point 0.3 to zero point 0.5, zero point 0.5 to zero point 0.1, like that they will ask. So you have to remember this zero point 0.3 to zero point 0.5. And prevalence, that is 5 to 30% per thousand. Okay, these three has to be remembered, and repeatedly they will be asking for NEET SS. So coming to the definition, what is the definition of epilepsy? This is not seizure I am talking about. This is epilepsy. Okay. So this epilepsy is defined by at least two or more unprovoked seizures occurring more than 24 hours apart. Okay. So if within 24 hours, if there is two episodes of seizures, it is considered as only one seizure. Understood? So this is a two or more unprovoked seizures occurring more than 24 hours apart. This is the definition of epilepsy, because this they will give in clinical scenarios. A patient presented with two episodes of seizures within 24 on the same day, and he was diagnosed something something. Whether does it fit into the definition of epilepsy? So it is not. Okay, so it is more than 24 hours. And sometimes with one also we can diagnose epilepsy. How? If the general recurrence risk is at least 60% after two, that is same as the recurrence risk of after two episodes. What is the recurrence risk? If the recurrence risk is same even after the first episode of seizure, then it is called as you can call it as epilepsy. See, this is a very ambiguous, and many of the neurologists does not like this definition, because what is the general recurrence risk, how do we calculate? So it is all theoretical. So that is the reason why, means even if one seizure is there and there is some tumor or something like that, then we can take it as high chance of, or some there is some gliosis in the brain, so then we can call it as epilepsy. So third one will be diagnosis of an epilepsy syndrome. Okay, then all these three will come into the definition of epilepsy. So, what is this diagnostic scheme? This was not recently done. It was old Axis diagnosis scheme. In seizure also it was there, and many other diseases you will be knowing, especially used in psychiatry. Okay, so this they will keep on asking because the Axis 4 here is the etiology. Okay, many of times you might realize that axis 3 will be usually etiology, but here axis 4 is the etiology. The axis 1 is ictal phenomenology, axis 2 is seizure type, axis 3 is syndrome, axis 4 is etiology, axis 5 is impairment. So it is an old classification, but in I have myself got this question. That is the reason I have put axis 4 is the etiology. Usually what we will do, axis 3 we will put as etiology, but here because there is one ictal phenomenology, the seizure type and syndrome, then etiology has moved downwards. So basically seizure was divided into focal and seizures. See, one thing important, as a physicians you people are maybe final year or you have finished your MD preparing, obviously we will be preparing for super specialty, may not be neurology or something else, but you will encounter seizure as a doctor in any of the specialties. Okay, so you have to be very clear about these concepts. So there are two types, only focal and generalized. Okay, focal means what? It is within the network limited to one part of the brain. Generalized means what? See, generalized, the previous definition was bilateral hemisphere onset. That is not true, na. Two, three times bilaterally, it cannot onset. It cannot have any onset. So the thing is here, it will have onset one side and rapidly engage the networks distributed across both the hemispheres. That is called as generalized. This definition will be repeatedly asked because to confuse you. So what they will ask is uh, so and so seizure onset at one particular part of the brain and rapidly engaged across the cerebral hemispheres, and it is asked also, and few of you might recall this question. It is not focal. Just because it is in one part of the brain, it is not focal. When you see rapidly engaging the other networks, okay, the generalized seizure does not mean entire hemisphere should be involved. Part of the bilateral brain should be involved. Okay, this is a very important uh, uh, differentiating between the focal and generalized seizures. Okay, so focal seizures do usually have a focal abnormality, so structural abnormality. And if there is a structural abnormality, most commonly it is a drug resistant. So if it is drug resistant, surgical treatment is an option. So just one concept, if you know, you can guess multiple questions. Focal seizures will have structural abnormality. To read like this only. So structural. Oh, so structural means drug may not means drug resistance may be more. So that means surgical options should be considered early. So in contrast, generalized seizures is due to cellular, biochemical, structural, bar metabolic. See, generalized seizure means what? Uh, the diffuse cerebral involvement is there. Either if there is anything diffuse or symmetrical, you remember in brain, it is usually something is more or something is less. That means something problem in the blood. So that the blood is not bringing something which is very much required. That is like oxygen, that is hypoxia, hypoglycemia, or it is giving something which is toxic. Okay, some toxin mediated carbon monoxide, like that. Anything symmetrical in brain, anything it is diffuse, usually think of metabolic, that is blood related, because blood is the only one which is common to every part of the brain, na? So that's why. So seizure also like that. Any seizure first comes, think of a generalized, that is biochemical, structural causes, biochemical metabolic causes, later structural. Okay. So what is this classification? So classification of seizures. So what you people make mistake here is this is not a classification of epilepsy. So this is a classification of seizures. Okay. So this is the classification of seizures. So focal onset, generalized onset. Okay, in focal onset, it can be motor or non-motor. In generalized onset, also motor or non-motor. Unknown onset. Okay, this is the seizures. So epilepsy means it will be different. Okay, epilepsy means it is a focal epilepsy, generalized epilepsy, unknown epilepsy, or it will be epileptic syndrome. And structural causes will be like etiology will be metabolic, genetic, idiopathic, cryptogenic, and like that. Okay, so these are the definitions. So it is a seizure classification, it is not epilepsy classification. Many a times you will get mistaken with this classification. So this one more important thing is, it is the onset. You can see here, focal onset, generalized onset. You just have to worry about how the seizure was started. It is not how it ended. Most of the seizures might end in a generalized way. Okay, so does not mean the onset was generalized. Understood? This is a very important concept. Usually, most of the seizures end in a generalization, but however, onset may not be generalization.